guys, it's Sonia here with Aaron. As you see, Aaron is in a hospital gown. And Gunner's here as well, of course.
Overdose update.
It's a little family.
Don't say that, it's not true. Look, we're all up at the hospital because Aaron is having a medical emergency. The chronic wound that he has on his hip. I'm going to try not to use too many words because you guys know me, I say too much. But basically, he's had this chronic ulcer for like 20 years. And for 20 years, we've been trying to get this fixed, and we've just been like brushed off and given the runaround. Maybe I'll go into detail about that a bit more later. But basically, had this wound that wouldn't heal. And even about 17 years ago, they were telling us that it's probably because there's some infection in the bone. And in spite of that, we could not get a bone scan, a CT scan, right?
Right.
Like we really tried. It was. We'll tell them more, I guess, but about how that went. But anyway, like we really tried, and even in the recent years, and even this year. So the wound was chronic, but it didn't like smell bad or anything like that. And then a couple of months ago, it started smelling really horrible. So I got the clinic involved. I got the nurse to come over. She's like, she couldn't do anything. They said you need an appointment with wound care. We couldn't get one. We'd have to see our doctor first. And then, I don't know, we just got the runaround a lot. In the end, they gave me a swab and told me to swab it and bring it in. I did that. Did I? Well, I don't know. We just, like, it went nowhere. Finally, I brought him in again because he had an infected finger. That was dealt with right away. And we told that doctor, he's got this problem with his hip. It smells really bad. And that guy swabbed it that day. And then we found out what it was infected with, and he got antibiotics. And it got better. But in the meantime, they had also given him a referral to come to this hospital to get a scan on his bone to check for a bone infection. So when he came here, he was waiting in the waiting room, and he was fixing his glove. And
Oh my God. Yeah, I was fixing my glove.
Yeah, you tell them.
Like,
It was his Terminator glove, like his orthotic glove. He's going to show you. He was fixing it with some scissors.
I can make my gloves out of like pressure, puncture-proof tire tubes, you know. So like they need to be constantly maintained, right? You know, so I was just like cutting some material to repair.
With some scissors.
With some scissors. And like, all of a sudden I get confronted by like 4 security guards. And this, I guess she was like the head nurse of the emergency. She comes up and she rips it out of my hand like I'm a child, you know. I mean, they have no respect, people, these days, you know, like, I mean, obviously, you know, I'm working on my glove, but they can't put that together because they're so, like, bent on thinking everybody's got a weapon, everybody's dangerous.
Don't get excited, don't get excited.
You know, but it's just...
But anyway, so then what happened?
Oh, man, I just, like, give me back my... Like, they took all the tools I was using to fix my gloves and put them in the bag, and we'll give this back to you when you know, after your thing. I say, you give it back to me right now. I'm leaving here. I'm never coming back to this place. This is ridiculous. So, you talk to people like they're children. Like, it's pretty obvious I'm not running around trying to attack people. Like, can't you put that together in your head?
Well, let me tell them what I did after. So he comes back and he's like, I didn't get the bone scan, and he tells me what happened. And I was like, oh my God. So I was feeling like it's my fault because I didn't go with him. Because when I don't go with him, like for some reason something always goes wrong. People take one look at him and his dirty hands, and they think he's a street person, and he just gets the shit treatment. So I called the ombudsman. I made a complaint. I told them what happened, but all they said was, well, he can come back. They didn't want to. So we went back to the clinic, and they gave us a referral to get a scan done at RaddyMed in Westmount. But I couldn't get him to go, you know, like I said a couple times, listen, you need to go get this thing. I went over there, I tried to get an appointment, they said it's on a walk-in. He wasn't really motivated. But in the meantime, the antibiotics were working, we figured, because the smell went away. So we just thought it's like a normal wound, you know, super infection, like it's colonized and it just got out of hand. And we used antibiotics and it's gone. Because this happened before, not that smell, but like he's had other infections where it was oozing a funny color or whatever, but usually it goes away. So we thought things were under control. So 2 months goes by and he's totally fine. And then about 4 days ago, the smell was back, and it's like a bad, like a fishy, like really bad smell.
So you
What?
not too graphic.
Not too graphic, no, but like it was a bad smell. So I was like, oh my god, the smell is back. So I went to the clinic and I got him in there on the walk-in yesterday, and that doctor gave him. She gave him a prescription for antibiotics,
I'm okay.
but she gave him also another requisition for an X-ray. And this time I said, listen, Aaron, you've got it here, because he didn't want to go. He's like, no, I want to go do something else. I was like, you're already out. We're together. I've got the papers. Go now. So he goes, and they do an X-ray of his hip. And I would like to show the X-ray here. I don't know, maybe I will. But if you do see the X-ray, what you're going to see is the whole top of the femur is missing. That's from a surgery. And then it just looks super gnarly. That's because there's an infection in the bone, which has probably been there for 20 years, which we've been trying to get taken care of.
You have to
Hi.
go for a CT scan.
Okay.
Oh, he's going
Sorry
for a
to
CT scan.
interrupt your Chinese.
Okay, they just took him for the CT, and then they're gonna put him like inpatient, like on the other side of the ER. So basically, when the doctor who had referred him saw that scan, she was very alarmed. She called me. She said it was urgent. He had to go to emergency immediately. She said that there was infection in the bone and there was an abscess in there, and that it was producing gas. And that right there scared the shit out of me, because I've heard of things like gas gangrene, and I know that when something is producing gas in an infection, it's like the worst kind you can have. And I was like, oh my God, is it gas gangrene? She said, no, but it's an abscess that's producing gas, but still just the fact that there's gas. I was like, oh my God, like my head was spinning. I was like, oh, this is really bad, you know? And she said, he has to go right away because it could become a necrotizing fasciitis, like literally a flesh-eating disease. Now, clearly he doesn't have flesh-eating disease right now because he doesn't have a fever and he doesn't have the signs of flesh-eating disease on his leg, but let's just say it was urgent because it could become something like that. I think that we caught it in time. Like, I'm feeling optimistic. They've got him on IV antibiotics, but basically the thing is, like, maybe I'll do another video about all the crap we went through, or maybe I already told you most of it. But anyway, it's been 20 years that he's had this and that they've known there's a bone infection. 20 years. We've been trying to get it dealt with. We've tried to get scans. The closest we came was the time he came here and got kicked out of the emergency. We used to come to wound care here, and we'd ask repeatedly to be referred for a scan, and they would say they were putting him on the list, and then the time would pass, and then I'd call and I'd say, what's going on? They're like, you're not on the list. And the last time they did it, they even had him fill out all this paperwork, and then 3 months later I went up there and I was like, well, what's going on? When is he gonna have his scan? And I was so well known there, like, cause I was, you know, as his caregiver, like I knew the nurse, I knew the secretaries. I like literally walked in there, walked to the secretary's office. I knew her by her first name. And I was like, Chelsea, what's going on? And she's like, he's not on the list. And so we were like, you're blacklisted, man. Like, they won't even do it. And there was a doctor up there called Dr. Brown, and Aaron overheard him saying, I'm not operating on Aaron, you know, as in like you've had enough surgeries and that's it for you. So we were very discouraged, and they did a lot of things, like they put a vac on his wound. Oh, hey.
I just closed the door.
He's in there? He's been in there for a while?
A little bit already. Should be fine soon. How long? It takes
Yeah.
30 minutes?
I don't know. Yeah, he had his IV antibiotics and he's getting the CT scan. We're hoping that he's going to be okay. We're hoping it's not too serious. We can just get rid of the infection somehow. I don't know if he's going to need surgery. Let's hope they don't take his whole leg off. I don't think it's, you know, like life-threatening, but it might be leg-threatening, which,
Life-threatening.
yeah, it's leg-threatening. Anyway, we'll keep you guys posted. Thank you for your prayers. You know, please pray for him. And yeah, I mean, we kind of knew like this could happen, and I mean, like I said, we knew he had a bone infection for all this time, and we couldn't get anything done.
He's moving.
So it's not like a complete surprise, but it was a shock today when she said that, and then I just prayed about it, and I told Gunnar, like, don't worry, it's in God's hands, and you know, We'll get through it. It'll be okay. Oh, there's a CT machine right there.
Now you've really been microwaved.
You did it. You did it. You had your scan finally.
Yeah, finally,
Yeah.
How are you feeling?
Okay.
Yeah? Antibiotics agreed with you?
Yeah, they were okay.
All right, good.
Yeah.
So what's he gonna do now? Just hang out here in the hall for a bit?
Well, I'm calling for someone to bring him back to the emergency, and from there, you're gonna get any result if there's any.
Is he inpatient or should he get back in his chair?
No, he stays in the stretcher. He's a patient.
So I'll keep you updated. Thanks, guys. Love you. See you soon.